Welcome to the Gus Alva Perspective, a podcast that's earmarked to endeavor along the lines of discovery of psychiatric themes. I'm excited that I get an opportunity to share some time right now with my dear friend Roger McIntyre, who will actually be our keynote speaker for the Southern California Psychiatry meeting. And the particular topic that he's going to be addressing is the intersection of metabolism and mood. We've known for a long time that different neurotransmitter synthesis, inflammation, as well as cytokines and the hypothalamic pituitary adrenal axis being dysregulated can cause some serious problems. So, Roger, please tell us what you're most excited about addressing in this particular keynote.
Thing for me, Gus, what's made this so thrilling for me is that I actually think we're getting closer to MIT, not that famous institution over in Cambridge, Massachusetts, but what I mean is mechanistically informed therapeutics. You know, what we want to tell a patient, Gus, you and I know this, we've been clinicians for a long time. I want to tell a patient before I retire in this unbelievable surreal career I've had, tell a patient, guess what? You know, Mrs. Doe, Mr. Doe, I want to say this treatment is going to stop your illness. This treatment is going to reverse your illness. This treatment is going to be curative for you. And that type of aspirational thinking is only possible if we have, in fact, the scientific rigor and the comprehension of understanding the mechanism and treatments to stop the illness and reverse it. This is why we call it mechanistically informed therapeutics. As you know, Gus, serendipity is a good friend of psychiatry, but serendipity cannot be a strategic framework going forward. And now we've got reasons to believe, triangulation of evidence, that metabolism is not just associated with mood disorders, that is, obesity, diabetes type 2, and metabolic syndrome, fatty liver, so on and so forth. But we now believe that the mechanisms that are subserving depression and bipolar, perhaps other conditions, including not limited to Alzheimer's disease, include metabolic systems. And if that's the case, we have an incredible opportunity to target those systems directly. That's mechanistically interesting, but as a patient, as a lived experience, who cares? My who cares is maybe we can stop these darn illnesses in their track. That's what I'm especially interested in.
That's amazing. And you know what? That's exactly what we're trying to accomplish here. Looking at topics that are salient for us, taking a look at things that we might actually be able to apply immediately, and then subsequently walk away with a feeling of, again, curiosity as well as really intent. And being aware of all of these different things is just so important. And I know, Roger, you've been deep in the the nexus of all of these different things, and so that's why I'm particularly grateful that you've acceded to coming out, visiting us here in Huntington Beach, and enlightening us on some of the more recent work that you've been involved with. Anything else that you want to share with our audience?
Well, I think really, for me, Gus, this is in fact a derivation of many ideas and thoughts over the years, but it really begins like many incredible journeys, and that is with patient encounter. And as a clinician, I was always curious why the adult with depression and bipolar disorder is differentially affected by anhedonia and cognitive impairment. And this question became a light bulb moment for me looking at metabolism. I did not know at the time that, in fact, metabolism and obesity do metastasize to your brain. That was a phrase that I coined to capture the relationship between metabolism, including insulin, glucagon-like peptide 1, other incretins, including not limited to glucose, insulin-otropic polypeptide. These are just multi-syllable words that don't mean a whole lot to a lot of people, but Ozempic does. And I often ask people, are you taking vitamin O? And they go, what's that? I said, well, it's a metaphor for these new class of drugs. Of course, Ozempic has almost, TikTok and Instagram fame, but these are drugs that have transformed not just diabetes and weight management, but are now, in fact, late-phase development as treatment and prevention strategies for many neurologic and psychiatric conditions. And that campaign was justified on the basis that we learned that you are producing GLP and other metabolic peptides in the brain. Gosh, you and I for many years have been talking about around the world how critical alterations are in neuroplasticity and neurotrophism as critical molecular and cellular alterations in mental illness. And that fact has provided this incredible opportunity then to explore medications. Some are new, de novo, some are repurposed that can facilitate plasticity and trophic activity. And for us, what's so interesting about these types of metabolic interventions is that they are targeting the molecular and cellular systems right in the crosshairs of what we think is altered in mental illness. That is, those systems critical to plasticity and trophic activity. I've never had a patient say, "Hey, Dr. McIntyre, I want to get a drug that helps my trophism." They want medications that can improve the quality of their life, their well-being, their cognition. And that's the sweet zone, Gus. You and I know this is an area we struggle with, trying to get patients thinking better, feeling better. And these drugs are returning to people back this sense of hedonic tone, hedonic control, as well as cognitive control. And this is the essence of human life. This is the essence of getting back on trajectory, which every patient wants. So this is exciting. This is in addition to all their fit-for-purpose application that the FDA has approved, such as diabetes, obesity, heart disease, kidney disease, and obstructive sleep apnea. But we're talking about developing these drugs as treatment. And guess what, Gus? Here's a bad word in psychiatry: prevention of mental illness. And I say that with facetiousness, but these drugs being prescribed in obesity and diabetes seems to be reducing onset of depression. How cool is that? So we're going to talk about the rationale for this, the observational, the clinical, the translational work, and also get into a conversation of what the future looks like with respect to developing these drugs for the prevention and treatment of mental illness.
Roger, well, I'll tell you what, being an investigator in several of these endeavors that you just addressed right now has obviously made me keenly aware of all of these different things. But metabolic targeting in psychiatry is really one of those nascent areas that I think that you will be one of the diplomats of really being able to advocate for this to the general psychiatrist or, again, psychiatric practitioner. And so I'm delighted that you're going to be with us. Thank you so much for spending time with us right now, Roger. I can't look, I am giddy with just thinking about the fact that July 11th, 12th is coming up fast. Thank you so much.
Thanks for having me. I look forward to being at the conference in Southern California. Always fun, and look forward to meeting many, many colleagues while I'm there.
Excellent. Thank you, Roger.
Take care, Gus.
Take care.